Hello, fellow cats and dogs owners. This is Dr. Cola. If this is your first time watching a video about managing your pet's weight, I highly recommend checking out episodes 2 and 3 as well. In episode 2, I explain how you can easily measure your pet's body condition at home. And in episode 3, I delve into how to calculate their daily caloric needs and determine their ideal weight in detail. Today, I'll be sharing the key points of weight management based on the 2021 Weight Control Process Guidelines for Cats and Dogs published by the American Animal Hospital Association. Interestingly, the guidelines from the American Animal Hospital Association and the Association for Pet Obesity Prevention are quite similar. But one notable difference is that the AAHA specifically addresses pets during gestation and lactation. The AAHA emphasizes that the key to managing obesity lies in nutritional assessment. This assessment is divided into two categories: screening and extended evaluation. Since obesity is closely tied to nutritional status, the guidelines classify obesity evaluation as a subcategory of nutritional assessment. The screening evaluation is a fundamental step performed every time your pet visits the clinic and includes the following elements: body weight, body fat index, BFI, body condition, score, BCS, muscle condition, score, MCS, limb circumference evaluation, and fecal examination. The study highlights that the accuracy of BCS evaluations tends to decrease when body fat percentages exceed 45%. Consequently, BFI is considered a more effective tool for distinguishing pets with high body fat, such as those in the BCS 8 to 9 range. This is precisely why I previously introduced the method of combining Hill's BCS and BFI for practical use. Limb circumference evaluations and fecal examinations are vital components of health checks for cats and dogs, and I will share simple methods for pet guardians to perform these at home in an upcoming health checkup segment. Another critical evaluation method is the MCS, muscle condition score. This involves visually inspecting or palpating the muscles along areas like the spine, skull, and pelvis to assign a score based on their condition. This method is particularly useful for the early detection of conditions like cachexia, severe muscle loss accompanied by significant weight loss due to illness, or sarcopenia, decline in muscle mass leading to reduced physical strength, and is categorized into 4 stages. However, there are limitations to consider. BCS does not directly assess muscle condition. BFI can estimate body fat percentage, but cannot accurately measure muscle mass. Lean body mass, LBM, which is the value obtained by subtracting body fat from total body weight, is a critical factor for the overall health and longevity of pets. For cats and dogs, lean body mass is not just a number, it forms the foundation of their health. LBM plays several vital roles, such as acting as a reservoir of amino acids needed to build proteins, which are essential components of all cells, including immune cells and red blood cells. A decline in lean body mass can lead to the following negative impacts: compromised immunity, muscle weakness, and mobility issues, delayed recovery. Therefore, maintaining or increasing lean body mass is a crucial factor in protecting your pet's health and even extending their lifespan, making the MCS evaluation an essential tool. The extended evaluation phase involves collecting more in-depth information based on risk factors identified during the screening evaluation. This stage is particularly important for obese patients, as it focuses on developing a clinical diagnosis and systematic treatment plan. An extended evaluation becomes necessary when the BCS is outside the optimal range of 4 to 5. The MCS, muscle condition score, shows signs of muscle loss to any degree. The primary causes of obesity can be broadly categorized into 3 factors: excessive calorie intake, reduced physical activity, genetic predisposition. These factors can further be divided into human-related and animal-related causes. Let's take a closer look at these distinctions. First, among human-related factors, the most common issue is that pet parents often overfeed their pet's primary diet. Many pet parents struggle to accurately calculate their pet's nutritional needs or find it challenging to adjust long-established feeding habits. Another frequent issue is pets gaining access to other animals' food bowls, leading to overeating. In such cases, it becomes difficult to track the total calorie intake of the pet. Therefore, it is essential to compare the total calories consumed by the pet with the recommended caloric intake based on their ideal weight and adjust the feeding amounts if necessary. Regularly reassessing and adjusting the ideal weight and recommended caloric intake is also critical. Additionally, overfeeding treats or other non-primary foods can be problematic. To maintain the nutritional balance of the primary diet, treats and extras should be limited to no more than 10% of the pet's total daily caloric intake. Pet parents also often overestimate their pet's activity levels. Insufficient exercise frequently exacerbates obesity. To address this, the following strategies can be effective. For cats, providing activity tools like feather toys, cat trees, or exercise wheels can encourage physical activity. For dogs, using activity trackers can motivate pet parents to engage more, leading to increased walks or playtime. To prevent obesity, animal-related factors should not be overlooked. For example, after spaying or neutering, a pet's energy requirements decrease, making it crucial to adjust their food portions accordingly. Additionally, certain breeds are more prone to weight gain. Breeds such as Labrador Retrievers, Beagles, Norwegian Forest Cats, and Persians have a genetic predisposition to obesity. Even if a pet is currently at an ideal weight, pet parents must always be mindful of the potential risk of obesity and take preventive measures. Middle age and senior years in pets are critical turning points for weight management and monitoring body weight changes. During middle age, dogs often experience a decrease in energy requirements, increasing the likelihood of weight gain. This is due to a gradual decline in metabolic rate. While the timing and degree of this change vary depending on the breed and individual pet's lifespan, it's clear that weight gain during middle age plays a significant role in the onset of obesity. As pets enter their senior years, weight loss and a decline in lean body mass often occur. This can lead to reduced muscle mass, weakened immune function, and decreased physical strength, requiring closer attention to their health. For cats, aging is commonly associated with a decline in the digestibility of fat, protein, and energy. This reduced digestive efficiency can lead to insufficient nutrient intake. As a result, slightly increasing energy intake for older cats may be necessary to maintain their health and well-being. Choosing a weight management diet for pets requires careful consideration of their overall health condition. If your pet is obese but otherwise healthy, selecting a weight-controlled diet might not pose significant challenges. However, when obesity is accompanied by specific illnesses, the situation becomes far more complex. For instance, if a pet has both chronic pancreatitis and chronic kidney disease, the recommended diets may conflict low fat for pancreatitis and low protein for kidney disease. These conflicting dietary needs can be a significant source of concern for pet parents. To complicate matters, different veterinarians may provide varying advice, adding to the confusion. To address this issue, I'll introduce nutrition adjustment guidelines based on specific diseases, as outlined in a paper by the American Animal Hospital Association. Diseases can generally be categorized into three groups. Diseases that require adding or increasing specific nutrients. In this category, the pet needs to replenish deficient nutrients to support their health. Examples include atopy, osteoarthritis, neurological disorders, diarrhea, and constipation. Diseases that require eliminating or reducing specific nutrients. Here, the goal is to limit harmful components that could negatively impact the pet's health. Examples include food allergies, urinary stones, pancreatitis, vomiting, liver diseases, hyperlipidemia. Lastly, certain diseases require both adding and eliminating specific nutrients, such as diabetes, cardiovascular diseases, and kidney disease. In particular, the paper highlights that weight management diets are highly recommended for obese cats and dogs with conditions like diabetes, feline cystitis, constipation, and osteoarthritis. When dealing with these conditions or situations where certain nutrients need to be increased, selecting a weight management diet is relatively straightforward. This is because weight management is critical for these diseases. And the key features of weight control diets, such as increased protein and dietary fiber, can also aid in managing these conditions effectively. However, challenges arise in cases where certain nutrients need to be reduced, or where there is a mix of requirements for adding and eliminating nutrients. For instance, diseases like liver disease or kidney disease often call for a low-protein diet, whereas weight management diets typically follow the principle of high protein and high fiber content to lower energy density. In such situations where the nutritional needs of a diet conflict with disease management requirements, it can be very difficult for pet parents to make decisions on their own. That's why my most important advice to pet parents is, don't try to figure it out on your own. Consult your veterinarian. I aim to clearly distinguish between what pet parents can do at home and what they should leave to professionals. For the aspects you can manage at home, I will provide detailed guidance to empower you to take the best care of your pets. This paper, though written to educate veterinarians, emphasizes the importance of effective communication with pet parents. One key takeaway is that failure to achieve or maintain weight loss goals in obesity management is very common, and a major contributing factor is owner non-compliance with guidelines. What's important to note here is that placing full responsibility for a pet's obesity on the pet parent is not necessarily the correct approach. However, raising awareness about the significant role human-related factors play in obesity can be a valuable step. This helps pet parents recognize their role and understand that there are opportunities for improvement, fostering a sense of empowerment to take actionable steps. In the next session, I plan to discuss the lack of awareness among veterinary professionals and industry stakeholders regarding pet obesity. While I've focused on educating pet parents to address obesity issues so far, the next episode will highlight areas where the industry needs to improve and take responsibility. This has been Dr. Cola. Thank you for watching and see you next time.